This segment is sponsored by the George Washington University Hospital. November is Lung Cancer Awareness Month, and this morning we are joined by two doctors from the George Washington University Hospital to share why this month is so important. Today we welcome Dr. Keith Mortman, Chief of Thoracic Surgery, and Dr. Sora Ely, thoracic surgeon. So welcome to the both of you.
Thank you, Ely. Thank you for having us.
All right, so let's talk about lung cancer and why it's such a concern right now.
Sure. Many of your viewers are probably aware how October was Breast Cancer Awareness Month, which is extremely important. We're here today because November is Lung Cancer Awareness Month, and we think fewer people are aware of that, and we really wanted to elevate the conversation. And one of the reasons why that is so important is because lung cancer, unfortunately, kills more people in the U.S. than the next three leading causes of cancer combined, more than breast cancer, colorectal cancer, prostate cancer.
Wow.
So it's actually the #1 cancer killer in both men and women in the U.S.
Wow.
So according to the American Cancer Society, this year there'll be around 230,000 new diagnoses and unfortunately about 125,000 deaths from lung cancer. So it's a pretty significant problem.
So, trying to be proactive about your health is probably really important. So Dr. Ely, what can people do to be proactive against lung cancer?
This is a great question because actually I think many people are not aware that there's a screening test for lung cancer. So I should say, though, that not everyone qualifies for screening. The eligibility is based on age and smoking history. But if anybody is between the ages of 50 and 80, quit smoking less than 15 years ago, or is still smoking, and has a total of 20 pack years or more of smoking history, they should be getting screened. So the pack years can be a little confusing. All that is the number of packs per day that you've smoked multiplied by the number of years that you've smoked. So as an example, if I had smoked a half a pack of cigarettes per day for 40 years, a half times 40 is 20, and I would be at the qualifying limit. The actual screening test is very simple. It's just a CT scan of the chest, which takes about 60 seconds. There's no IVs, no labs required, and it should be done every year, not just one and done. The good news is most insurance carriers cover this with no cost, no copay to the patient, and that includes Medicare and DC Medicaid.
Oh, okay. And you guys also, we should mention, have a screening coming up, correct?
We are actually participating in the National Lung Cancer Screening Day, which is traditionally the second Saturday in November during Lung Cancer Awareness Month. And so centers across the country, including ours, our lung cancer screening program here at GW, is going to be open on Saturday hours to have people screen and raise awareness about lung cancer screening.
So Dr. Ely, can you tell us maybe some of the symptoms that people should look out for? Unfortunately, I know too many people that have experienced lung cancer who've never smoked before.
Absolutely. So the most common symptoms that lung cancer patients will present with are unexplained weight loss, new or worsening shortness of breath, and cough. And not just any cough, but a cough that really won't go away or even gets worse. Some less common symptoms would be coughing up blood or chest wall or bone pain. But I do want to emphasize that really, unfortunately, lung cancer doesn't cause any of those symptoms until it's pretty advanced. And so that's why screening is so critical, so we can catch it at the early stage where we have a really good shot at cure.
That's incredible. And Dr. Mortman, I would love to ask you, what are those treatment options for patients?
Yeah, so as Dr. Ely was saying, the outlook for patients when they're caught early with lung cancer using a screening tool like CT scan, the outlook is actually very good. So when we use our different treatment options at GW Hospital, such as minimally invasive surgery, which includes robotic surgery, we have newer radiation techniques with our radiation oncologists that can really pinpoint the abnormal tissue. And we have newer chemotherapeutic agents, so more focused targeted therapies and immunotherapy, all of which, when combined, really offers our patients the best possible outcomes and a cure for the earliest stages of lung cancer.
Well, that's very encouraging. I thank you both so much, and hopefully people will pay attention and hopefully catch it early if so, and we'll have great care from you guys. Thank you so much for your information today.
Thank you.
Thank you for having us.